Hi, I'm Dr. Janet Storella, and I'm the Medical Director of Breastlink Maryland and the Director of Breast Imaging for Community Radiology Associates. Today I'm going to talk with you about the BRCA gene and risk of developing breast cancer. Mutations in the BRCA genes are one of several genes that can confer an increased risk of developing breast cancer. Most people became aware of this when Angelina Jolie disclosed that she herself had a mutation in the BRCA1 gene and chose to have a preventive bilateral mastectomy. If you have a mutation in the BRCA1 gene, that can increase your lifetime risk for developing breast cancer in a range of 50 to 85%. And if you have a mutation in the BRCA2 gene, that can increase your risk in the range of 40 to 60%. Just to put that in perspective, lifetime risk for women in the general population is 8%. So, how do you tell if you have the BRCA gene? The only way to know is by having genetic testing. But I will caution you that genetic testing is not for everyone, since only about 5 to 10% of people who have breast cancer do have one of these mutations. Family history is absolutely key to determining if you should have genetic testing. And the kinds of questions that you need to ask to determine if you're increased risk are the following. First, do you personally have a history of breast cancer before the age of 40? Second, do you have any family history of ovarian cancer? Because the BRCA gene mutations also put people at risk for developing ovarian cancer as well. Are there any men in your family who have had breast cancer? Do you have combinations of breast cancer and ovarian cancer on one side of your family? And finally, women who are of Ashkenazi Jewish descent also are at increased risk, especially if they have family history of breast or ovarian cancer. If you think that you are at increased risk, I recommend that you have formal risk assessment. So there are many physicians and risk clinics in our area that offer risk assessment. In doing these formal risk assessments, the physicians and genetic counselors will take a very detailed history, and that's going to include all kinds of risk factors, not just your family history. They'll then put all of that information into various computer models and determine what's your personal risk of developing breast cancer. Based on that risk, they can recommend whether or not you should have genetic testing, whether there are preventive methods that you should be considering, or whether you should have heightened surveillance. From an imaging perspective, we at CRA are able to offer heightened surveillance if you have a lifetime risk of 20% or greater. Typically for my patients who are at these higher levels of risk, I recommend alternating your mammogram at 6-month intervals with your MRI. So say you have your mammogram in the summer and then you have your MRI in the winter. And that way, every 6 months I get a different way to check you out and make sure that you're healthy. So thanks for tuning in, and get in touch with us at CRA if you have any questions.